Hi, my name is Abby Rockers. I'm an 8th semester nursing student. Today is August 22nd, approximately 10:35. And today I'll be explaining to my patient here how to insert a chest tube and just teaching along with having a chest tube inserted. So that's what we'll be talking about today. So I'd first knock on the door, introduce myself, provide hand hygiene. Hi, my name's Abby. I'm going to be your nurse today.
Hi.
How are we doing today?
Oh, not so good.
Okay. So Megan here, she had trauma. She was in a accident with a go-kart and flipped out of it, and now she has blood in her pleural space. And so she's having difficulty breathing because her lungs are not able to expand properly. So today we're going to be putting a chest tube in to drain some of that blood out of that pleural space to ease her breathing. So I'm just going to explain a little bit about what the procedure is going to be to her. So Megan, have you ever had a chest tube inserted before?
No.
Okay. So the reason that we're getting this today is because you have blood in your pleural space, which is the space between your lung and your chest wall. And that blood, there's blood collecting in there, and it's not supposed to be there. And that's why you're having difficulty breathing, because your lungs can't fully expand like they need to with that. So what we're going to do today, the physician is actually going to place this chest tube. He's going to make a small insertion in between your ribs, and this plastic catheter is going to be placed in there, and then this part of the chest tube will attach to that, and it will allow that blood to drain out into here. Now during that procedure, I'll be by you the whole time. We'll be monitoring you, making sure your respirations are fine, your breathing's okay, and we'll be keeping an eye on all your vital signs. And we'll also give you some medication to try to ease any discomfort that you might have with the procedure. And so what's going to happen once this is in is there's three main spaces in here that we're going to talk about. So this chamber A here is the suction chamber, and if the doctor may or may not order that, but if he feels like you need suction to help drain all that fluid out, that's what that space is going to be for. Now this B section here that goes all the way down, that is called a water seal, and we're going to fill it up to a 2 centimeter line, and right here, this 2 centimeter line. And what that's going to do is just prevent a negative pressure, so that any blood that drains out of here won't go back up into that pleural space that we're trying to get it out of. And then chamber D here, this is that actual collection chamber, and this is where we're hoping, this is where the blood will drain into. And as you can see, there's different lines here, and this will mark exactly how much is coming out. And at the end of each of our shifts, we're going to make a line to show where it's currently at, and we'll document that so the person coming on to the next shift knows where to monitor and chart all of your drainage, so we know exactly how much is coming out at all times. Okay. Do you have any questions about that part?
I don't think so.
Okay. So after you have this placed, we're going to really encourage you to not get up on your own. So anytime you feel like you need to go to the bathroom or get up, just let us know and hit your call light, and we'll come in and help you with that, just because we don't want this obviously coming out. Some doctors put sutures in, most of them do, some do not, but those little suture lines in there will help it hold into place. And so also after this is placed, let us know if you're experiencing any kind of pain or shortness of breath, anything like that. And we also want to create good pulmonary hygiene. So by coughing and deep breathing, that'll help those lungs expand properly. And so after, the physician will be checking in on your progress. Most people have these chest tubes in for about 2 to 3 days. We'll do an x-ray when we feel like there's been improvement, and we'll see if the lungs are expanding how we want them to. And if they are, then we'll go ahead and remove the chest tube, and the doctor will also do that again at the bedside. And this collection space, this is never actually emptied. What we do with it when it's done is it goes in a big red biohazard bag, and then we go ahead and dispose of it in the dirty linen room. And so after that's done, we'll document all the relevant data, But other than that, that's kind of going to be the main process of what we're going to be doing. Like I said, also after the procedure, we're going to continue to monitor. I'm going to listen to your lung sounds often to make sure that they're sounding okay. Do you have any other questions for me today?
I don't think so.
Okay.